It's Sound Advice with audiologist Doug Leonard from Audiological Services of Iowa. October is Audiology Awareness Month, and we use the phrase test your ears at 50 years a lot, but it's great advice. How many times, of course, do you find yourself asking your partner, your person you're with, maybe the person you work with, what did you say? Didn't quite catch that. I mean, it's a pattern that people use all the time, and it might be a sign of something.
It certainly could be a sign of hearing loss, of course, John. And I think people are just not really aware of how many times they do that. You know, if you're the one with hearing loss, you don't always recognize that. But if, again, you're that significant other, the spouse, the coworker, or the friend who is constantly having to repeat things for that patient with hearing loss, you know how often they say things. And, you know, I pay attention to that just obviously is my profession. You know, I'm out and about in the general public. And when people are frequently asking to repeat, I think that person is probably someone who should test their ears at 50 years.
So do you have the actual numbers?
Well, we posted a study that we saw on our Facebook page. It was interesting. They say that the average person asks, "What do you say?" or some form of that 3 times a day, or 91 times a month, or almost 1,100 times a year.
I think that's underestimating that.
I mean, it is I ask my wife 5 times a day what she says. So, and you know, we both have fairly normal hearing, so it probably is an underestimate.
Yeah, but that just kind of underscores the fact that hearing health is really underestimated in this country, and I think underappreciated.
I agree, and you know, that's what I think so important about our program, Sound Advice, is just getting that message out there about it. You know, it isn't just hearing aids, it isn't just whatever. We touch on a whole bunch of different topics and things that I don't think people always realize, and sometimes don't get from even their traditional healthcare providers.
Yeah, here's another stat for you. 2 out of 3 people have never had their hearing checked. That's an incredible number.
I would love to know the exact stat on the number of patients, say, in that 50 to 70-year-old category who've seen a dentist in the last year, who've seen an optometrist in the last year, versus who've seen an audiologist in the last year. Mm-hmm. And I'm sure it would be shockingly low having hearing evaluation.
And again, if you ran through some of the symptoms of maybe some hearing problems, that might sound real familiar to people.
Yeah, you know, obviously frequently asking to repeat things, seeming to be disinterested because the patient's kind of zoned out of a conversation, responding inappropriately. You know, if someone asks you a question but you respond totally out of left field, it's not necessarily a cognitive issue. It could be just a communication issue or hearing loss.
Keep those in mind, of course, and a lot of people, again, look at things like cost of hearing aids, things like that, and they think that's a big barrier, but it really is not.
The study did quote cost as a barrier to seeking healthcare. Honestly, I really think that the largest barrier to seeking healthcare is the fact that people don't realize they're having a problem. Our hearing loss occurs so gradually that patients are not aware of it. And, you know, it's something that if it isn't bleeding or it isn't falling off, we don't necessarily seek help for it medically. And so hearing loss would fall into that category for a lot of people. You know, I noticed that with sudden hearing loss. Patients that have sudden hearing loss, maybe they had a virus or an inner ear infection or something, they come in almost immediately and they tend to overestimate their degree of hearing loss. Mm-hmm. People that have had gradual hearing loss from getting older or being around noise or hereditary issues vastly underestimate how much hearing loss they have and don't seek help as soon as they should.
I have no doubt about that. And by the way, if you want your spouse, or maybe if you want to say what a lot less often, get your hearing checked. It's the quickest way to help that. Doug, what's the number here at ASI for them to set up that appointment?
Yeah, we'd love to hear from them. It's 792-5933.
Give them a call and check it out. Your hearing health is extremely important, especially check it out during Audiology Awareness Month.